Body temperature. Today we will be dealing on the topic of body temperature. Introduction. Body temperature is the level of heat maintained in the body. Living organisms are classified into two groups based on regulation of body temperature. So the two groups are based on the homeothermic animal and poikilothermic animal. So homeothermic animal maintains constant blood body temperature. Body temperature remains stable despite environmental changes. Birds and mammals, including humans, belong to this group, also called warm-blooded animals. Poikilothermic animal body temperature is not constant. Temperature changes according to environmental temperature. Amphibians and reptiles belong to this group, also called cold-blooded animals. Measurements of body temperature. Body temperature can be measured at different parts of the body. So in mouth, we can check an oral temperature, axillary temperature, rectum, rectal temperature, skin surface temperature. Normal body temperature. Normal human body temperature is 37 degrees Celsius, which is 98.6 degree Fahrenheit when measured orally. Normal range varies between 35.8 degree Celsius and 37.3 degree Celsius, which is 96.4 degree Fahrenheit and 99.1 degree Fahrenheit. Temperature at different parts of the body. Axillary temperature measured in axilla, which is the armpit. It is 0.3 degrees Celsius to 0.6 degree Celsius, which is 0.5 degree Fahrenheit to 1 degree Fahrenheit, lower than oral temperature. Rectal temperature measured in the rectum. It is 0.3 degree Celsius to 0.6 degrees Celsius, which is 0.5 degree Fahrenheit to 1 degree Fahrenheit, higher than oral temperature. Surface temperature or skin temperature. Temperature over the skin surface varies between 29.5 degrees Celsius and 33.9 degrees Celsius, which is 85.1 degree Fahrenheit and 93 degree Fahrenheit. Core temperature. Core temperature is the average temperature of deeper body structure. It's always higher than oral or rectal temperature. Normal core temperature is about 37.8 degrees Celsius, which is 100 degree Fahrenheit. Variations of body temperature. Body temperature shows both physiological and pathological variation. Physiological variation. First comes the age. In infants, body temperature varies with environmental temperature because the temperature regulation mechanism is not fully developed. In children's, body temperature is about 0.5 degree Celsius higher than adults due to greater physical activity. In old age, body temperature decreases slightly because heat production is reduced. Second one, sex. In females, body temperature is slightly lower than in male because of lower basal metabolic rate, which is your BMR rate. During the menstrual phase, body temperature decreases slightly. Diurnal variation. In the early morning, body temperature is about 1 degree Celsius lower. In the afternoon, it reaches the maximum about 1 degree Celsius higher than normal. After meals, body temperature rises slightly about 0.5 degrees Celsius after meals. Exercise. During exercise, body temperature increases due to heat production in muscle. Sleep. During sleep, body temperature decreases by about 0.5 degrees Celsius. Emotional condition can increase body temperature. Menstrual cycle. Immediately after ovulation, body temperature rises sharply by 0.5 degrees Celsius to 1 degree Celsius. During the menstrual phase, it decreases by about 0.5 degrees Celsius. Pathological variation. Hyperthermia, which is fever, abnormal increase in body temperature. Hypothermia, abnormal decrease in body temperature. Heat balance. Regulation of body temperature depends on the balance between heat produced in the body, heat loss from the body, heat gain or heat production in the body. Various mechanisms involved in heat production are: first one is the metabolic activity. So major amount of body heat is produced during metabolism of foodstuffs. This is called heat of metabolism. Fat metabolism produces maximum heat. Heat produced during metabolism. Fat is about 9 calories per liter of oxygen. Carbohydrates about 4.7 calories or liter of oxygen. Protein about 4.5 calories or liter of oxygen. The liver produces maximum heat due to high metabolic activity. Muscular activities. Muscles produce heat both at rest and during activity. About 80% of active heat is produced by skeletal muscles. Role of hormone. Thyroxine and adrenaline increase heat production. They increase metabolic activities in the body. Radiation of heat from the environment. Body gains heat from the surrounding by radiation. This occurs when environmental temperature is higher than body temperature. Shivering is shaking of the body due to rapid involuntary muscle contraction during cold exposure. It is a compensatory mechanism to produce large amount of heat. Brown fat tissue. Brown adipose tissue is a special type of fat tissue. It produces large amount of heat, especially in infants. Heat loss of the body. Maximum heat is lost through the skin. Small amount of heat is lost through respiratory system, kidneys, gastrointestinal tract. Heat loss occurs when environmental temperature is lower than body temperature. Methods of heat loss. Conduction. About 3% of heat is lost by conduction. Heat passes from the body surface to objects like chair or bed through direct contact. Radiation. About 60% of heat is lost by radiation. Heat is transferred as infrared rays from the body to surrounding objects through air. Convection. About 15% of heat is lost by convection. Heat is first conducted to surrounding air and then carried away by air currents. Panting. Panting is a rapid, shallow breathing associated with excessive saliva loss. In animals like dogs, they lack sweat glands. Heat is lost by evaporating of water from lungs and saliva during panting. Evaporation. About 22% of heat is lost by evaporation of water. Small amount of water continuously evaporates from skin and lungs. This unnoticed water loss is called insensible perspiration or insensible water loss. It is about 50 ml per hour during increased body temperature, sweating increase, and more heat is lost through evaporation. Regulation of body temperature. Body temperature is regulated by the hypothalamus. Hypothalamus maintains body temperature around the normal set point of 37 degrees Celsius. It contains two temperature regulating center, heat loss center and heat gain center. Heat loss center. Heat loss center is located in the perioptic nucleus of the anterior hypothalamus. The neurons present here are heat-sensitive nerve cells called thermoreceptors. Stimulation of the center causes cutaneous vasodilatation, sweating, removal or lesion of this nucleus, increased body temperature. So this is the regulation of body temperature, how the cycle takes place and the body temperature remains normal while the body temperature gets increased or decreased. Heat gain center. Heat gain center is also called the heat production center. It is located in the posterior hypothalamic nucleus. Situation of these centers cause shivering and heat production. Removal of lesion of these nuclei causes fall in body temperature. Mechanism of temperature regulation. When body temperature increases, increase in body temperature also rises body temperature. Warm blood passes through the hypothalamus, stimulated thermoreceptor in the heat loss center of the perioptic nucleus. The heat loss center brings body temperature back to normal by promotion of heat loss, prevention of heat production. Promotion of heat loss, increased sweating, sweat secretion increases, more water evaporation from the skin along with heat. These lower body temperature. Cutaneous vasodilatation, heat loss center inhibits sympathetic center in posterior hypothalamus. This causes vasodilatation of skin blood vessel. Blood flow to skin increases. Heat loss through sweat and radiation decreases. Prevention of heat production. Heat loss center inhibits heat production mechanism such as shivering, metabolic reaction. This reduces heat production of the body. When body temperature decreases, when body temperature fails, it is restored to normal by prevention of heat loss, promotion of heat production, prevention of heat loss. Sympathetic centers in posterior hypothalamic causes cutaneous vasoconstriction. Blood flow to the skin decreases. Heat loss from the body is reduced. Promotion of heat production. First, shivering. Heat gain center stimulate the shivering center in posterior hypothalamus near the wall of the third ventricle. Shivering occurs due to rapid muscle contraction. Severe muscular activity produces large amount of heat. Increased metabolic reaction. Sympathetic center stimulates secretion of adrenal, noradrenal. These hormones increase cellular metabolic activities and heat production. Hypothalamus also secretes thyrotropin releasing hormone TRH. TRH stimulates pituitary to release thyroxine stimulating hormones, which is the TSH. TSH increases secretion of thyroxine from the thyroid gland. Thyroxine increases metabolism activity and heat production. Chemical thermogenesis. Chemical thermogenesis is the heat production due to hormone included metabolic activities. Applied physiology. Hypothermia, fever, elevation of the blood temperature above the normal set point is called hypothermic fever or pete. Fever itself is not a disease but an important sign of illness. If it helps the body fight infection and disease. Classification of fever. Low grade fever, body temperature rise to 38 degrees Celsius to 39 degrees Celsius, which is 100.4 degrees Celsius to 102.2 degree Fahrenheit. Moderate grade fever, body temperature rises to 39 degrees Celsius to 40 degrees Celsius, which is 102.2 degree Fahrenheit to 104 degree Fahrenheit. High grade fever, body temperature rise about 40 degrees Celsius to 42 degrees Celsius, which is approximately 0.4 degrees Celsius to 0.7.6 degrees Celsius. Hyperexia. Hyperexia is an increase in body temperature about 42 degrees Celsius, which is 107.6 degree Fahrenheit. It can damage body tissue. Further rise in temperature becomes life-threatening. Causes of the fever is infection, hypothyroidism, brain lesions, diabetes insipidus. Signs and symptoms of fever are headache, sweating, shivering, muscle pain, dehydration, loss of appetite, general weakness, effects of hypothermia, confusion, hallucination, irritable, convulsional. Hypothermia, decrease in body temperature below 35 degrees Celsius, which is 95 degree Fahrenheit, is called hypothermia. It occurs when the body cannot produce enough heat to maintain the normal activity. Metabolic activity become impaired. Temperature below 31 degrees Celsius may become fatal. Elderly persons are more suspension. Causes of mild hypothermia. Mild hypothermia Classification of hypothermia. Mild hypothermia, temperature falls to 35 degrees Celsius to 33 degrees Celsius, which is 95 degrees Fahrenheit to 91.4 degrees Fahrenheit. Moderate hypothermia, temperature falls to 33 degrees Celsius to 31 degrees Celsius, which is 91.4 degree Fahrenheit to 87.8 degree Fahrenheit. Severe hypothermia, temperature falls below 31 degrees Celsius, which is 87.8 degree Fahrenheit. Causes of hypothermia: exposed to cold temperature, immersion in cold water, drug abuse, hypothyroidism, hypopituitarism, lesions of hypothalamus, hemorrhage in brainstem, especially pons. Signs and symptoms of hypothermia: mild hypothermia, intense uncontrolled shivering, poor coordination of movements, pain and discomfort due to cold. Moderate hypothermia, shivering slow or stops, muscle becomes stiff, mental confusion and apathy occurs, shallow respiration and drowsiness develop. Weak pulse and low blood pressure, strange behavior may occur. In severe hypoxia, extreme weakness and exhaustion, bluish gray, cold skin, diluted eye, gradual loss of consciousness, slow breathing, stiffness of arm and leg, very weak pulse and severe fall in blood pressure. Further fall in temperature may lead to death. Thank you all.